pharmacy student from Polytechnic Health Ministry of Bengkulu. In this video, I will discuss about Clonorchiasis that tourists must be aware of if they want to go on a trip to Indonesia. Keep watching the video. What is a liverworm infection, Clonorchiasis? Clonorchiasis is a disease that occurs due to Clonorchis sinensis infection or Chinese liverworms. Clonorchis sinensis belongs to a group of elongated flat-lipped, such as dermatodes. This type of worm can infect the liver, gallbladder, and bile duct, which occurs endanger the body. Cases of liverworm infections. Liverworm infection begins with emission of Clonorchis sinensis eggs by snails that live in freshwater. These eggs will hatch in the body of the snail and begin to undergo phases of a worm development, ranging from the miracidia phase of the Clonorchiasis larva. This part of the larva is hand released by the snail through the phase into the freshwater environment. Furthermore, larvae that swims in the freshwater make it possible to touch and penetrate the body of a fish or even be eaten by it. Humans can be infected with this parasite worm when eating freshwater foods that are not well cooked, salted, pickled, smoked, or dried. Clonorchiasis in a freshwater fish will enter the small intestine and the liver. This cheese will slowly damage the body organs within 3 months to cause symptoms. People infected with liverworms can pass it to others through phases containing worm eggs and repeat the cycle from the beginning again. Signs and symptoms of liverworm infections. Liverworm infection in the body show typical symptoms that distinguish it from other worm infections, namely inflammation and blockade of the bile ducts. In the acute phase, this disease can cause stomach ache, nausea, and diarrhea. Chronic Clonorchiasis originates from a continuous infection that is left untreated and progressively worse. In a long-term infection, swelling of the bile system can cause cancer of the bile ducts. In effect, the International Agency for Research on Cancer (IARC) classifies the Clonorchis sinensis parasite as a carcinogen cause of cancer for humans. If allowed to continue, this can be life-threatening. Can liverworm infection be prevented? The good news, Clonorchiasis cannot be transmitted directly from one person to another. Transmission of these infections requires the media of other living things, such as snails and fish that are the media for the transfer of these parasites. Thus, you can't make a number of prevention efforts so as not to get infected with liverworms, including: Number 1. Do not eat raw food such as vegetables, pork, beef, and fish meat. 2. Drinking water that has been cooked or bottom yourself mineral water to maintain security. Number 3. Maintain personal hygiene after going on a trip. Number 4. Pay attention to clean lines without cutting nails. Number 5. Get used to wash hands before eating or after defecations. Number 6. Cook the fish at a minimum temperature of 63 degrees Celsius. Treatment of liverworm infections. Before treating liverworm infections, your doctor will first check the presence of parasites in your body. This can be identified through endoscopic procedures, ultrasounds, CT scans, MRA, or microscopic examination of faces. These procedures are carried out to find the presence of worm eggs in the intestine or those that have developed into worm cysts. After your doctor confirms a pharmaceutical infection, your doctor may prescribe praziquantel. the only drug recommended by the World Health Organization for the treatment of clonorchiasis. This drug is taken 3 times a day for 2 to 3 consecutive days at the dose of 25 mg per kilograms. Therefore, consult your doctor immediately if you feel the signs and symptoms of clonorchiasis. Tips for tourists. Number 1. Do not eat raw food during culinary tours, such as vegetable, pork, beef, and fish meat. Number 2. Drinking water that has been cooked or bottled yourself mineral water to maintain clean lines. Number 3. Maintain personal hygiene after going on the trips. Number 4. Pay attention to hands hygiene by cutting nails. Number 5. Get used to wash hands before eating or after defecations. As a pharmacy student, because the incubation period varies according to the number of worms that exist or the symptoms cases require a long time, understand the symptoms that will be caused when you have returned from a tour. Symptoms that may be caused include: Number 1. Discomfort in the upper right quadrant abdomen. Number 2. Anorexia. Number 3. Indigestion. Number 4. Abdominal pain or distensions. Number 5. Irregular bowel movements. Patients suffering from severe infections will experience: Number 1. Feeling weak. Number 2. Weight loss. Discomfort in the epigastric regions. Full feeling in the abdomen. Diarrhea, anemia, and edema. In an advanced stage, jaundice will occur, portal hypertension, and last ascites, and upper gastrointestinal bleeding. If after going home you experience the signs and symptoms above, I suggest to go to the hospital because to determine the fresh scan or abscan of the worm requires a diagnosis through a microscope, checking fecal samples for first type worm age, oocysts, protozoa, and tachyzoids. If the result of your examinations are positive, doctor will prescribe an anti-emetic drug, which is praziquantel, work by immobilizing the worm and removing it naturally through the stools. Worm infection such as Clonorchiasis and Clonorchiasis. Warning: this medicine is a prescription drug category, so you can get it only by prescriptions from a doctor. Okay, that's all video this time may be useful for your before goings on vacations. Stay healthy and make your day always happy. See you guys.